Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right, so without further ado, I'm excited to pass it off to Dr. Lyday with Neighborhood Gastroenterology and Nutrition to lead us in today's program.
Okay, well, thank you very much for that introduction, and happy to be here. I hope everyone's doing well today. This is a topic of many topics I'm interested in, but I think this is something that's in the news a lot and everyone's curious about is the gut microbiome. And our practice is 50% medical exam and typical medicine sort of treatment, and then the other half is nutrition, wellness, weight management. So those are the two divisions of our practice. But I'll start into this, and I'm always fine with questions during the talk, but I don't know if that's going to be possible. But for sure, we'll take questions at the end. It's a lot of information, and I hope I don't overwhelm you all, but I'll give it a good try, and we'll do at least a good overview of everything related to the gut microbiome that might be useful to you. My background, well, so I'm currently in a private practice, and I'm the director of Neighborhood Gastroenterology. Prior to that, I was with Cancer Treatment Centers of America. You may have heard of that. It was a hospital south of Atlanta. I was their founder of their gastroenterology nutrition department. And I worked with them for about 5 years, and I learned a lot about cancer and cancer care and nutrition. Prior to that, I was in a large practice here in Atlanta with some great colleagues. And then my educational background, I'm a UNC North Carolina Chapel Hill guy. And I did my fellowship in Nebraska for 3 cold years in Omaha, Nebraska. And now we're here. So that's my background. So I have a lot of interest in cancer, gastroenterology, and nutrition. So this is sort of my wheelhouse. I learned a lot of lessons working at the cancer center. I think one of my biggest observations was that cancers don't seem to follow the rules and the guidelines. And I saw a lot of patients that maybe they didn't fit the guideline, or they were getting their screening, but they still developed a cancer, and nothing that apparently they did wrong. So I became a little bit frustrated with guidelines. I know they're useful, and of course they do catch a lot of people with cancers and prevent them, but there are a lot of people that seem to fall through the cracks. And I really thought that the cancer center and cancer treatment is very developed once you have a cancer, but there's not as much before you have a cancer. And I just thought, shouldn't we be doing more to prevent cancer? So that's sort of where my interests have gone. Of course, everyone should have their screening test, but it seems like there should be more that we can do now on our own individually to lower our cancer rates and prevent recurrences as well once we've been diagnosed with a cancer. So these are all the ideas that have been on my mind for quite a while. What more can we do beyond screening? How can we reduce recurrence rates? What can we do individually to lower our risk while we wait for our next screening test? So these are the ideas that led to the formation of what I call the Cancer Prevention Center, sort of a new concept, but trying to make it just as robust as a oncology center. That you would come into this program, and it would be an intensive looking at all the things that possibly raise our risk of cancers. And as I did my research on this subject over the last several years, I mean, the things that are consistently showing good science, good data, strong reports are the connection with obesity in cancer. So I think a cancer prevention program should focus on that. Nutrient deficiencies, lifestyle, our habits, specific diets that might be related to cancer. There's a lot of interest in natural supplements, and some seem pretty interesting that may possibly lower our cancer rates and risks significantly. And then finally, the gut microbiome, and that's how it made it onto this list, is, in my opinion, part of my cancer prevention concept. So that's sort of the backdrop of why I got interested in the microbiome. And so that was a little bit of my journey. And I'm always open to looking at new ways to lower cancer rates. Is there something we can do proactively? Something that's maybe not risky to us, but it could be just a change in diet or a behavior. The microbiome is in that category. So I thought I'd just quickly go over how I approach cancer prevention. I think it is multi-pronged. It's not just one thing. Certainly, the microbiome is not responsible for all cancers. It seems to be one of the many factors. So I thought it might be just worthwhile. Just quickly, we'll go over sort of the different ones. Cancer and obesity. You might wonder why weight management. There have been a lot of articles on the connection between obesity and cancer risk. A lot of good evidence that shows losing weight maybe lowers our risk of recurrence and it lowers our risk of ever getting a cancer. And there's been lots of studies, and you can see a lot of the GYN cancers, a lot of the gastro cancers, all have strong associations with obesity. So I think that's an important part of preventing cancers and recurrences. The NIH put out a diagram sort of saying the same things, but just different areas of the body. You just, maybe wouldn't naturally make that connection that there's a connection between weight and these different tumors, but there's been strong evidence that they clearly raise risks from ovarian to esophagus to breast. So a lot of wide variety. So weight management and obesity are definitely issues for someone who wants to lower their risk of cancer. Of course, nutrition would be on that list. And basically, when I look into nutrition, a lot of deficiencies are associated with cancers, especially esophagus, but really all the tumors have some association with nutrient deficiency. You can also have excessive levels of nutrients and vitamins, and that actually can be dangerous as well. So we believe that's definitely part of a risk reduction program, is to be aware of any deficiencies or excesses too. Probably the most studied for these tumors: colon, breast, esophagus, ovarian, pancreas, others. Vitamin D and calcium, I'm sorry. That seems to consistently come up in the studies. Folate is important. The vitamins A, B, C, zinc, magnesium, selenium. These all sort of consistently across the board seem to have a connection to cancer risk and rates. Interestingly, elevated iron, which you see in a condition called hemochromatosis, has higher rates of cancer. Copper elevations, so you can have excess nutrients and minerals that maybe raise risk. So that's important to understand and know early on. What else? So lifestyle, that's pretty probably obvious to everyone, but there have definitely been studies showing sedentary lifestyle when we're not fit, not exercising. There's definitely a connection to cancer recurrence and cancer rates. Obviously, smoking is no good, excess alcohol. So these are sort of in the lifestyle arena. Let's move to the next slide. And then dietary changes are also thought to be very beneficial, and there's good evidence showing that certain foods are clearly related to higher cancer rates and recurrences. So we want to be sure we're avoiding refined carbohydrates, a lot of the fried foods, high sugar beverages and foods. Red meat has a lot of negative data. Seems to be have a lot of carcinogenic potential. Processed meats are terrible. Again, excess alcohol. Foods that seem to be good, I think a lot of people know this probably, but fruits and vegetables and omega fish oil and salmon, nuts, seeds, legumes, whole grains. All this is part of a cancer prevention diet and thought to be protective. Supplements are interesting. I find myself going into rabbit holes on this, just looking at the different medicines and supplements and natural products that are out there. A lot of them actually do have very good data. Aspirin is probably the most interesting to me in how it interferes with the inflammation pathways and seems to lower a lot of the cancers. But there's several others that I think are on the list of interesting, not really recommended universally, but a lot of people are studying these, and I'm quite sure there'll be a day when we're, in addition to doing other things, taking our supplements that has anti-cancer benefit as part of our strategy to lower cancers and recurrences. So this is an interesting topic. We use these on an individual basis, but I don't think it's widespread and not part of standard care. And so finally, we'll get back to the gut microbiome, which is the topic of this conversation. And just as a little backdrop, there are actually trillions of bacteria, but also fungi, viral elements that are all in our gut. And they're there all the time. They're doing all sorts of things. And no one's really thought about them until the last several years. We didn't really understand they had a big role in health, and we didn't really understand any connection to anything else, excuse me. So the microbiome is definitely a hot topic now and something we're all very interested in. And again, the gut bacteria, a lot of diverse functions. It's the bacteria, you may or may not know, is very important part of your digestion. It actually helps you break down foods and nutrients. It has other functions too. It protects our gut from other bacteria. And probably you've heard of C. diff and other infections that take over the gut when the protective bacteria is not present. That often happens after you're on antibiotics and you get a C. diff infection. The gut bacteria actually has an interesting interaction with the neurologic or immunologic system, and it basically trains the gut not to over respond to bacteria and not to under respond. And they think this may have something to do with Crohn's disease and colitis, and maybe there's some abnormal bacteria involved with that. No one's ever proven it, but it does have an interaction with our immune system, and it's an important part of the immune system. The gut bacteria also produces a substance called short chain fatty acids, and this is a very beneficial molecule that nourishes the colon and intestinal wall, and also gives us gut health. And that's a critical, important function of the gut bacteria. And it's also important for our vitamin nutrient absorption. And so it has lots of functions, and I don't think we ordinarily think of it very much, but it's pretty critical. And I think it's one of those things when it's working well, we don't think about it, but when there's a problem, we suddenly become very aware of the role the gut bacteria plays. So just to summarize again, it's very important for digestion, for vitamin absorption, fat absorption. It regulates our immune system, which is a very complicated interaction, not totally understood, but it seems to be an important part of our gut immune system. The bacteria produce short chain fatty acids, which are very important in decreasing inflammation in the gut and keeping our intestinal lining healthy. I didn't mention the graph above, but it also is involved with our neurotransmitters and serotonin. That may be part of the gut brain axis, the brain fog that a lot of people describe when they have abnormal gut bacteria. So it has sort of a mood connection. And they're also finding that the gut microbiome has a connection to endocrine function or blood sugar, appetite, cravings, has a lot to do with a big connection with fatty liver and even insulin resistance. So all implicated and now known to be associated with our gut bacteria. So what is dysbiosis? So dysbiosis is the term we use when there's an abnormality in our gut microbiome. So dysbiosis is sort of a general term. Basically, it means there's some imbalance of bacteria, either too much of good bacteria or not enough good bacteria, or loss of a diversity of the gut bacteria. So there's some sort of imbalance. It's not the normal levels and distribution that it should be. And that leads to a term called dysbiosis. And that's where we start to see problems in the gut. So what causes dysbiosis? What causes these imbalances of gut bacteria or a bad bacteria taking over? So it's multifactorial as well. We think it's highly associated with diet. So high fatty foods, Alcohol seems to be negative. People that had GI infections or pneumonias or required high dose antibiotics can wreck your GI system and change the gut bacteria. Again, they associate with lifestyle, so obesity, sedentary, all those things seem to lead to abnormal gut bacteria. And the basic pathology is when you have normal bacteria, but then it starts to change into dysbiosis, you start to see injury in the cells. You can see that sort of in the middle graph. You'll see injury to the cells, and then eventually there's enough damage that bacteria and inflammatory molecules are getting through the colon cells into the bloodstream, and they're not only harming the colon cells, but they're also affecting the rest of the body. And that's they believe is connected to people with fatty liver who maybe have cirrhosis. They think that's connected to neurodegenerative diseases, possibly heart disease, diabetes. So that's somehow the connection. So again, things that really affect our gut bacteria, our diet. So a diet that's high in processed foods, high fat foods is not helpful for our bacteria. People that are on antibiotics, although sometimes you have to be on antibiotics, but we try to do it sparingly, and we are aware that antibiotics can have some negative effects. Infections of the gut. So we see this all the time in my clinic. You know, someone's had a gastroenteritis, either a virus or a bacteria, and after that, for months or even longer, their digestive system has changed. They don't digest normally, and that could be dysbiosis. They've developed a different bacteria in the gut. People with underlying conditions, this dysbiosis has been strongly connected to Crohn's disease, ulcerative colitis, celiac disease, and it's a little bit of the chicken or the egg. They don't know if the abnormal bacteria had something to do with causing the inflammatory bowel disease, or is it the other way around? The inflammation and injury to the intestinal tract from these diseases, did that lead to abnormal gut bacteria? But there's a lot of interest in this because no one really understands these conditions, especially Crohn's and ulcerative colitis, and there could be a bacterial connection to that. So that's an area of active research. The abnormalities in gut bacteria can be associated with people getting cancer care. So people getting chemotherapy, radiation, it can do some damage to the gut, and sometimes people do get a dysbiosis. Alcohol, tobacco, obesity, we talked about. So I only put this slide up just to show how complex it is. And this is a little bit overwhelming, but the change in the gut bacteria and the damage it does to our colon essentially stimulates a huge cascade of molecular changes, cytokines, inflammatory cells, reactions in other areas, ultimately leading to, unfortunately, cancers that seem to be part of this pathway. So I just showed this to show how complex it is, but gut inflammation does lead to some very negative things in the body, both in the gut and outside of the gut. A little bit more on the leaky gut syndrome. So that you've probably heard of that term, leaky gut syndrome. A lot of people will use that word loosely, but essentially it's the damage that's done to the intestinal lining for whatever reason. Dysbiosis is a major cause of that. And the science of it is that your intestinal cells have tight junctions between them, and that's part of the gut integrity. And then when there's injury and inflammation, it breaks those cells down, so there's a weakening, and you lose sort of your barrier function in the gut. And that causes lots of problems. So that's where the leaking is coming from. So here's an example. So the normal colon cells, you see there, and they're intact, and the biome is normal. They have protection. Everybody's happy. And then in the other case, there's a lot of damage, and you'll see the cells actually getting through here, and these go into the bloodstream, and that's the leaky gut syndrome, where you're getting bacterial products and toxins and all sorts of things leaking into the bloodstream. The typical symptoms of a leaky gut, that's a common thing we would see in the GI clinic. Patients will often just present with bloating, gas, constipation, diarrhea. They might feel tired. That seems to be a common complaint. If it's gone on long enough and it's severe enough, they might have some actual nutrient deficiencies. Some people have attributed skin conditions to leaky gut. Definitely brain fog. A lot of people will describe they feel not clear, they can't think clearly. That could be related to the leaky gut and dysbiosis. They might have just diffuse joint pain and aches. And we think the leaky gut syndrome maybe stimulates your immune system and causes some of these autoimmune conditions with arthritis and other things. So these are all the possible symptoms of leaky gut. And then there's a lot of medical conditions associated with leaky gut. We've sort of covered this, but they definitely think people that have obesity have more of this condition. And it's again chicken or the egg. The leaky gut may actually also stimulate obesity and weight gain. We think leaky gut and dysbiosis are very connected to liver cirrhosis. Again, we mentioned these in the other slides. Neurodegeneration. They think the inflammation that's caused by the leaky gut actually affects the neural membranes, and it may cause inflammation in the brain, and that may be part of some of these neurodegenerative diseases like Alzheimer's and others. There seems to be a connection with cardiovascular disease because of the inflammation is widespread throughout the body. It may have a relation to that and some others. So some of these we've talked about. Probably the number one thing I see in the clinic is irritable bowel. That's often where it begins with a gastro practice, is someone having digestive symptoms, and then we go from there. And of course, one of the main concerns I have, and this is why I became interested in this topic, is that gut dysbiosis seems to have a strong connection to cancer risk. And again, the pathway seems to be that the dysbiosis, the abnormal bacteria in the gut, are causing inflammation, which is damaging to the colon cells. And these inflammatory molecules seem to promote DNA mutations in the cells and cause all sorts of changes. And this is definitely in the colon, but it also happens throughout the body. So the cancers that are associated with dysbiosis, we sort of mentioned this before, but a lot of the GI cancers, so colon, esophagus, pancreas, liver, stomach, and also the GYN tumors, breasts, endometrial, I didn't list here. It's also just interesting to think brain would be related or lung, but the studies seem to be showing there is a connection with having a dysbiosis and leaky gut syndrome with these cancers. So this is a very complicated slide, but it's too small to see, so I'll spare you. But they are starting to identify the actual bacteria that seem to be bad, and they're getting better and better. And I know in our office, when we do the gut microbiome test, we get I guess it's a 14-page printout, and we can see the exact bacteria, the level, their sensitivity to antibiotics. And so the researchers are now really publishing which ones they think are the worst bacteria. The good ones seem to be the bifidobacteria, lactobacillus. This is just too long a word to even say, but that's been listed as a beneficial bacteria, and there's many, many others. So we think there's protective bacteria in the gut, and then there's the bad bacteria. And these have been listed in the past as possibly promoting cancer, especially colon cancer. There's been a lot of studies with that. E. coli is a very common bacteria we've all heard of. Some of the strains seem to produce this molecule called colobactin, which directly causes DNA damage in the colon cells. But they're seeing that in a lot of these different types. But these are sort of on the top of the list for the bacteria that we know could be negative and harmful, especially if they're overgrown or in excessive levels. And generally speaking, with colon cancer, we typically think that's about a 10-year process from the first little bump that forms, that's just maybe inflammation. We think this is the usual pathway of colon polyps and cancers. And then over the years, we think they typically slowly progress from a small bump to a small polyp to a larger polyp. and you might have seen that word before, adenomatous polyp. That means it's in the sort of the precancerous category. And then over time, it becomes dysplastic. So it's starting to have some unusual cells there. And then over more time, it actually becomes cancerous, but maybe still within the polyp, maybe still contained. And then finally, it becomes a cancer that's growing into the wall. And we think that's typically a 10-year process, but again, we've all seen patients progress quickly. They may have even had their screening within a few years and they've suddenly developed a new tumor. Um, Most people have seen that and heard of it. It's, very disappointing. So we do think there's something else going on that maybe causes people to have an accelerated course. Maybe gut bacteria is part of it. We don't know, but the studies, and again, this is another complicated slide, but it just shows that the normal intestine, if someone's doing all the wrong things, they have sedentary lifestyle, they're obese, they have high cholesterol, they're smokers, they have a low fiber diet, and they also have a bad diet as far as sugars, and maybe they've had antibiotics, and they're getting dysbiosis, and so they have inflammation in the colon, and all sorts of bad things are happening. And a lot of the studies are showing that they think cancers are occurring more quickly in the colon and maybe recurring more quickly because of all the negative effects of dysbiosis and what it's doing to the cells and how it's stimulating DNA changes. So that's high on our list for prevention of colon cancer, but also other cancers too. So if I had to put this all together, I look at the gut microbiome as early in its development. It's certainly nothing standard of care. There's a lot of interesting research. I think people that have the gut microbiome test are basically the proactive person who wants to do a little more. And we just always make sure they understand this is not a clear guideline at this point. The studies are all interesting and seem supportive of looking and treating, but we don't know for sure. But I think over the next 5 to 10 years, we're going to have a lot more information on that. We do know the gut microbiome has many important functions. It's an important part of our um, digestion, immune system, protecting us from bad bacteria. We know that people that have abnormal gut bacteria called dysbiosis uh, seem to have a higher risk of all sorts of things, including autoimmune disease, heart disease, cancers, liver disease. And we do know that there's a lot we can do to have a healthy gut microbiome, and that's by changing our diet and changing our lifestyle and having awareness of this condition and testing for it possibly. And so I go back to it's one piece of the puzzle. For me, I use the gut microbiome as part of my concept for cancer prevention, which I think requires multiple things, not just the gut microbiome, but it is something that seems to be within our power to change and possibly something we can be doing between checkups and follow-up scopes and exams, and something maybe we can be more proactive about. So if in our center, if you came to the Cancer Prevention Center, essentially we would assess for dysbiosis. We do a stool microbiome test and we review that and treat accordingly. We will often do a nutrient panel and look for any evidence of deficiencies. If someone's obese, we enroll them into a medically monitored obesity program, weight management program. For lifestyle, we have a few coaches now, and they'll give accountability and coaching calls and work on changing diet and lifestyle. We recommend a cancer prevention diet that we think is most healthy and most likely to prevent cancers and improve health. We're interested in supplements. We do this sort of on a case-by-case basis, but this is sort of an uncharted territory. A lot of interesting science coming out, and I think in the future there will be more information about using supplements to prevent cancers and other diseases. And then fitness is sort of overlooked, but it is part of a cancer prevention program, and we incorporate that in our coaching program. That's part of something we monitor patients, that they're increasing their steps and improving their fitness levels. We think that's protective. So that's it. And again, our practice is divided between the gastroenterology side, where we see all sorts of gastro liver problems. That's our neighborhood gastro. And then we have the other division, which is focused on weight management nutrition called Life Plan Nutrition. And that has the coaching and the accountability and other people involved. So that will conclude my talk. I hope that was enough. I hope I didn't overwhelm everybody. But I think we can open up the floor for questions if anybody has any.
Thank you, Dr. Lyday. That's so much good information. I think such a hot topic. We have a lot of questions in the chat box, so we'll try to get to them all. I'm going to try to kind of group them, but I want to first start it off with, I know you talk about cancer prevention. Are all of these, just to clarify, still apply for reducing cancer recurrence too? All of these should be prioritized even if you have been already diagnosed with cancer?
Absolutely, yeah. I think it all applies whether you've never had a cancer or you've had one and don't want to get another one. All these are, I think, very much a part of a prevention plan.
So I'm going to start off, I think you touched with this on the end, but how are we actually studying someone's gut microbiome or gut microbiome as a whole?
Well, the way to do it is there's probably a variety of ways, but we use a stool microbiome test where we actually take a sample of the stool and then the laboratory will profile it and they'll give us this long 14, 15 page report of basically all the bacteria that they identified in the gut. And they'll also tell us if there are any markers of inflammation, lack of enzymes, or anything else abnormal, and then they'll give us a score, and they actually have a dysbiosis score, so they're able to test and say this is dysbiosis, this is not dysbiosis, and they can also look to see if you have a lack of diversity of gut bacteria. They think it's important that you have a lot of different species, and so they'll tell us if you have low diversity and do you have evidence of abnormal, imbalanced bacteria, and so we'll get a score from that, and then we'll have a very detailed breakdown of their what's it going on in their gut, how they're digesting, which bacteria are elevated, should we do anything about it? Does it have anything to do with anything going on as far as symptoms? So we find it pretty useful for that.
Okay, and we got a lot of questions talking about probiotics. I think this is something that's kind of on the forefront. Even when you go grocery shopping, everything is pushed as containing probiotics. So is this an antidote if you've been prescribed antibiotics? Is this something you should go out looking for a probiotic to help sort of regulate that? Or how do we?
Very good question. That's probably I think that's the number one question, or one of the number one questions. There's no probiotic that you could just say blanket wise, this is going to take care of dysbiosis. I think this is an evolving field, and the value of doing the gut microbiome testing is we know exactly what your profile is. So rather than just do a generic sort of shotgun approach with something over the counter, I think is useful to know what your specific patterns are. Some of the probiotics seem to be, they vary a little bit, and some are better for certain conditions and findings. So that's we try to tailor it a little more rather than just prescribe one, generically.
Okay, and this might have sort of answered the question. Do you feel like getting probiotics through food is more beneficial or maybe a pill? Which do you find?
I think definitely diet. Diet is number one. So you want to have avoid the bad things we were talking about earlier that stimulate gut dysbiosis. That's a lot of the different foods we eat. So that's sort of a deep dive, I think, with the dietitian nutrition team to really be sure you have that down. And then of course, eating the foods that are healthy for the gut bacteria. And then I think again, it's another gray zone. I don't think it's completely proven, but the probiotics do seem to make a lot of sense if you have dysbiosis for sure. And then just trying to use the one possibly that's tailored more to your need and what your bacterial profile is. But I think diet is definitely the place to begin. Partially eliminating the bad things, but also eating the right things.
And when you talk about eating the right things, I think we hear a lot about, I know you mentioned fiber. Is
Yeah.
there a certain amount of fiber people should focus on for a daily
Ooh,
intake?
There probably is. I don't know that off the top of my head. That's a great question.
Okay, and we
I
might
would
have
probably ask
some,
my dietitian.
I was gonna say we might have some dietitians on here who could answer
Yeah, they
this.
could help me with that one for sure.
We'll phone a friend. And then what
Yes,
are some,
I'm allowed one phone call.
yes. And then do you have some other foods that may be helpful that we could buy at a grocery store to sort of support a healthy microbiome? Are those going to be looking for like fermented foods or anything like that?
That's a good point. Yeah, those are good. There's a much more detailed list that I could give you. I'm going back to my slide about the bad foods. Yeah, fermented foods are good. They think, yeah, like Greek yogurt is often a good one. Things that have, bacteria sort of fermented. I'm not sure I'm saying the category correctly, but those are good. I think it's equally important that you're not eating the fatty foods, the high sugar foods, and the alcohol, as it is to increasing green leafy vegetables or raw fruits and vegetables, lean meats, avoiding red meat. Um, but again, we fully utilize our dietitian team, and they are expert on this subject because it is worthy of a talk unto itself. Just to go into the details of all the diet changes that are important, and I completely use them to support those kind of questions and what actually should you eat through the day and how to shop, etc.
Yeah, and this might, I don't know, you can let me know if question should go in that topic too that we kind of throw out to the dietitians. Do we need to be concerned about the effect of artificial sweeteners on the gut?
Ooh, that's a good one. I have not come across that in what I have researched on the microbiome. They do talk about sugar substitutes, so particularly the ones that end in OL. So the sorbitol, xylitol, mannitol, they seem to have some of the same effects as the other high sugar foods. So the dangers, you think you're safe because you're doing a diet sugar, but the sugar substitutes like the alls, the sorbitol, alcohol sugars seem to have a negative effect on the gut microbiome.
Okay. I think we'll probably pivot from food over to supplements a little. What are
Okay.
your thoughts on digestive supplements that are out there, and how do people know what's legit when we're at the store and looking at so many options?
I know. Well, I think we're going through sort of a transition where we've gone from ideas that are not bad ideas and just trying things. That's sort of the shotgun. Like I'll just try this vitamin, I'll take these enzymes, and not really knowing whether that's going to help, and sort of a trial and error. And of course, a lot of times we waste our time and money and maybe didn't even agree with our system. So I think we're moving out of that era. And now that we have better testing, we can actually know what is going on in our gut. We can know from the stool testing whether you're deficient in enzymes. So we can decide whether that would be useful. We can tell if there's inflammation. So we can really profile the digestive tract. Is considered functional medicine, but we're learning a lot more, and we're getting much more information on people that just have irritable bowel syndromes symptoms, and we can really nail down now what's the exact problem, and then just be very targeted. So I think we're getting away from just going to the drugstore and trying things. I don't think that's a good approach. I think it'd be better if we could just get tested and know more detail about what's going on in our gut, and then be more targeted.
Yeah, it could be a lengthy process of trial and error if we
Yeah,
are just throwing things out there.
yeah.
Um, so I think we did get a question. How do you recognize dysbiosis before it turns into leaky gut or experience fatty liver issues?
Well, I'd say it's not an exact science by any means. I think it's kind of a clinical diagnosis, honestly. So we think some people that have obviously they have GI symptoms, like we talked about the maldigestion, bloating, diarrhea, constipation, something in that area. I think a little bit of it is we learn maybe on the backside or the back end. So we'll get in charge of the diet. We'll treat for dysbiosis, and then we'll see if some of these symptoms go away. And they do seem to go away. A lot of patients will say, "Yeah, my brain fog is gone. My joints aren't aching anymore." all these things that we think are part of the leaky gut. But there's not like a test that we can say, oh, you have leaky gut. You were positive on the leaky gut test. We don't have a test like that. So I think it's a matter of, knowing your symptoms, knowing what's going on, and then treating and then observing to see what goes away. I'm sure there's plenty of people with joint pain that has nothing to do with gut dysbiosis. So we aren't at that point that we can say for sure what's causing it. But a lot of times we just see this on the other side when we treat people and we change the diet lifestyle. We notice all these body changes happen, and then we decide, well, that was probably the leaky gut.
And this one, I think you touched on. Can you talk about the impact of stress? I know it's hard to avoid, but how do you
Yes.
kind of balance stress and what is its effect on the microbiome?
That's a good one. I never go to stress first, and I'm not even sure. I think on this slide, stress, I think they're talking about oxidative stress. So that would be smokers, and again, things that cause inflammation in the body. Is there a like mental stress connection, a kind of a mind gut connection? There probably is. I don't think anyone's studied that as well or proven. Um,
Ooh.
my feeling is I usually treat everything I can find and see. And then if nothing's left, then I'm certainly open to the possibility that stress is a possible cause. A lot of people wonder, is it the stress itself or is it the things we do when we're stressed? So when we're stressed, we tend to eat bad food or we do bad things, we have bad habits. So a lot of the studies is confusing to know, is it the stress itself, the what that does in the body, or is it the behaviors that we adopt when we are stressed? So that's always, but I mean, it's on the list. I always try to find the things that I can visibly find on a test or, rule out everything completely before I go to anything psychological. But I mean, it's certainly on the list of possibilities.
Yeah, you're probably right. There's so much link between. I know I do not practice healthy habits when I'm stressed.
Right.
So it's just trying to get through
You
the
eat ice
day.
cream or yeah.
Exactly.
So yeah.
Um, and speaking of habits, so when we talk about the gut microbiome being connected to serotonin, how does that affect our mood, our sleep, our appetite? And I guess one question that did come in, how does fasting work with that too? So if we're trying to eat, what's the magic number of certain amount of hours before we
Ooh,
go to sleep that helps create a good
ooh. These are
microbiome?
good questions. I'm not able to answer all of them perfectly, but there's definitely studies showing that when people are fasting or they're on restricted calorie diets, they're losing weight, they've actually documented that their gut flora changes significantly. So that's one factor. So dieting, starving, rather not starving, but fasting can affect the gut bacteria in a positive way. So that's been observed. And then I don't think it's well known how, but we certainly observe it. A lot of people notice mood improves and brain fog is the big one. Often people will say is much better when their gut is healthier and happier and dysbiosis is under control. I don't know that it's increased serotonin or it's just abnormal, um, but there's definitely a serotonin connection with the gut and gut bacteria.
And I guess it goes back to that last piece. If you're feeling good, you're probably starting more motivated to practice all those healthy habits that kind of go into feeling better.
Yeah.
All right, we're going to jump to some of the other questions. One was, what are your thoughts on some of these new weight loss drugs that decrease or suppress appetite? Do you think that has an effect, or is there, I know some of those are newer, but are there thoughts on how that could affect your gut microbiome?
Well, and that's in we have a division just for the weight management, and we've used them for patients that want to go that route. And so far, everything seems to be positive. I've not tested gut microbiome sort of pre and post, so I've not done that. I've not heard of anyone doing that. But a lot of people will say their digestive system is better when they lose weight, and they clearly have shown that weight loss and however we do it seems to be positive for the gut bacteria. The populations change. We're probably because we're getting rid of a lot of the bad foods. Um, we have a lot of patients doing the GLP-1 medications like the Ozempic and the Wegovy's and Zepbound. And we're our big thing is we just don't want it to become a long-term solution. We want it to be a bridge. And then during that time you're using the shot, you're going to learn how to have an exercise plan and a eating plan and learn about your body. And I think it's a useful bridge. But all the studies I've seen otherwise have been pretty positive as far as those medications. My cautionary is I just don't want it to be the destination. I think it's a good bridge to a better place, get you out of the danger zone. But so far, we're not seeing any negatives with using those, other than you can overdo it, which is why we monitor patients so closely. A lot of people do lose excessive lean muscle mass, and they can really get weakened, and it can even be dangerous because their appetites are so suppressed. They're not getting sufficient calories. So it needs to be in a monitored program.
And kind of talking about the program, can you go over what is covered during a dietary consult with your team? And does that happen also with a stool analysis? Or are they looking at those together?
Well, I have two different pathways. Someone may see me, maybe they're high risk for colon cancer, or they've had colon cancer, or we've recently discovered a large polyp or a strong family history. So they may enter that pathway. And this again is just for the proactive person, certainly not required, but people sort of seek that out and want that, they want to be proactive. And so they would have a nutrition profile. We'd see if there's any deficiencies. We would do a stool microbiome test, see if there's any evidence of dysbiosis. If they had that, we would recommend a dietary change, possibly antibiotics based on their profile, and then possibly a probiotic. And then they would go into sort of a monitoring program, for follow-up endoscopy and things like that. The other pathway might be someone who just has some non-specific symptoms. They don't feel well, and we're now basically trying to figure out their IBS symptoms. Why are they having bloating, diarrhea, constipation, or excessive, abdominal symptoms? They've tried other things, nothing's working, and so now we're interested in their gut bacteria. And so that would be the gut profile. Sometimes we'll do a food sensitivity as well. Sometimes we'll check other things. And then that would be going over their profile and then changing it. And the goal being to just reduce their IBS symptoms. And so that would be partially me, the doctor, and then partially the nutrition team going over the findings. And then a lot of people continue with sort of a long-term relationship with the nutrition team as they work on their diet and make changes and tweak things until they're pretty happy with their symptoms.
And do you know, is that private pay or is any of that covered by insurance?
Insurance doesn't, in my experience, doesn't seem to cover the functional medicines. And so we've sort of just decided that probably is best just to be outside of insurance. So that's for the person who wants to do more. It's certainly not a requirement. And yeah, it's more or less cash pay.
All right, and this is kind of changing topics. We did get a question about alkaline levels. Does testing alkaline levels relate to the gut microbiome?
Ooh, I've not thought about that one. Although the time when we see alkaline levels, that means you probably have a stomach that's burned out from years and years of acid injury, and now you're not even producing acid. So now you have a higher pH, which is the other way to say alkaline. And there is thoughts that probably does promote excessive gut bacteria. Um, I can't say that I see that very often, but do we specifically test alkaline levels? No, we don't. But we certainly see people that after years and years of smoking or terrible acid inflammation, when we do the scope test, we can see their entire stomach lining is flat and it's probably not producing acid like it should, and they're probably alkaline patients. So I think there is a connection for sure.
And then we did also have someone ask, what are your thoughts on if someone is feeling bloated? What are your thoughts on using laxatives? What is that effect on the gut?
Well, of course, the first question is always, do they have warning signs? Is there any history of bleeding? Are they losing weight? Do they have family history of cancer? Assuming everything's no, no, no. Then, of course, we look at diet and some lifestyle things. Are you taking any medications that might be slowing down your bowels? So we check that off. And then we might even do some imaging just to make sure there's not some sort of obstruction or narrowing. So we check that off. And then once we've sort of done the drill, we've looked at your labs, there's no thyroid problems, you don't have anemia, your electrolytes are fine, everything seems to be normal, and it's just constipation. Then I am definitely a big fan of, I can go two ways. One is I'm a big fan of Miralax, which is over the counter, and it's a non-absorbable powder. You mix it in water, and I like it because you really can't overdose on Miralax. You can be very aggressive, and you can take sort of a higher dose initially and then lower doses going forward. And then the other pathway, some people just don't want to do a drink or powders and things. So that group prefers a pill. So there there are motility medicines that help with constipation. Amitiza and Linzess are two popular ones, and we have lots of patients that use those, and they seem to be very safe. And that's just a pill in the morning. I'm not as big a fan of the other ones. I guess I just like Miralax because you can go up or down. You don't have to worry about overdosing. Usually by the time they get to me, they've been through their primary care. So they've already gone through the Colace and they've gone through some of the other ones. So we're now ready to do something more aggressive. So either the Miralax or the Linzess or Amitiza.
All right. And what are your thoughts on the impact of going gluten and dairy free?
Well, a lot of people do feel better gluten free. I'll take that one first. Now, it doesn't necessarily mean you have celiac disease, which is a true genetic autoimmune disease where you're reacting to the gluten in basically bread and pasta and things. Some people just feel better because they feel better on a low carb diet. So a lot of people will notice when they cut out carbs, they just feel better. They have more energy. That does not mean they have celiac disease. So there is an easy test to do. It's called a celiac antibody test. It's a great screening blood test covered by insurance, and we can see if you have antibodies to the gluten in your bloodstream, and then we can know for sure. But some people just feel better on a low carb diet, and that's fine too. They don't. If that works for them, that's totally fine. And then lactose diet. That's probably the number one enzyme people lose as they get older is the enzyme in their gut that digests lactose. So a lot of people will notice if they have bloating, irritable bowel symptoms, cutting out the cheese and the milk and all the forms of dairy and going lactose free is sometimes an easy, simple thing you can do on your own because it's so likely connected to your bloating and GI symptoms. So I think that's something everybody could just do on their own and just see if they notice a benefit when they cut out cheese and milk and cream and all the different types of dairy.
All
Of
right.
course, you need your calcium, so you can go to lactose-free milk because you want to get your calcium. And there's almond milk, and so there's other alternatives. Fortunately, there's lots of things in the grocery store for lactose-free. Cheese is hard to get around. I know they say there are some forms of cheese that are not don't have lactose, but most of them do. So in general, you pretty much have to get rid of the cheese, which is a tough one
That
for most people.
that is a tough one for
That's a tough one to take. But
I can switch to almond milk, but I don't know about
yes,
cheese nuts.
yeah, that's a big one.
So this question is a little different from the other ones we've had. Do you have any experience or thought with MFT or fecal transplant? I know it's used, I think you can correct me, commonly for C. diff. Is there any
Yeah,
use in creating a healthy gut or microbiome with it?
absolutely. Yeah, there's a lot of interest in that because it gained its fame from people that had these recurrent bacterial infections called Clostridium difficile, which is that's totally a dysbiosis kind of situation where antibiotics knocked out your good bacteria, and now this Clostridium bacteria took hold and can just be devastating and dangerous even if it goes on and on. And there was a lot of success by changing the gut bacteria, and that's with the fecal transplants. And so that's actually being looked into for all sorts of things like Crohn's disease, colitis, because that kind of goes to the point we made about the gut dysbiosis and the immune system and how your bacteria sort of help control the immune system and how it reacts. And a change in flora can calm down the immune system. And also getting a normal bacteria back in place also protects you from the bad bacteria that's trying to take over. So I think that's probably the fecal transplant idea is going to be they're looking into other areas that might be useful for people with chronic GI inflammatory conditions.
It'll be interesting to see what comes of that.
Yeah.
So as we wrap up, Dr. Lyday, we talked a lot about ways we kind of ruin our gut microbiome. Can you just wrap up with a couple suggestions on how we can build our microbiome back up?
Ooh, building up your microbiome. Well, the first thing is, are you having symptoms? Um, and that might warrant a visit to the clinic if you're having lots of diarrhea, bloating, fullness. The simple thing is to avoid the high fatty foods. Basically, the Mediterranean diet has probably been the most promoted. Lean meats, fish, raw fruits and vegetables, whole grain foods, high fiber, and just trying to unfortunately get rid of all those high sugar, uh, simple carbs. That's what seems to promote the bad bacteria in our gut and leads to all these health problems. So Mediterranean diet is one example, and I'm sure the dietitians out there know there's some other great diets to follow. But essentially, cut out these heavy, rich, low nutrient value foods that are really causing havoc in our guts.
All right, and I think my last question is going to be, can you let everybody know how we can find you and connect with you to learn more?
Absolutely. Well, our home base office is in Roswell. We also do a lot of telemedicine, so if it's too far to drive, that's fine. But I don't know if can you see my shared screen still? GastroATL is our website, so you can go there and you can schedule your visit online, and we'll work you in. We're basically an outpatient practice right now, very rarely in the hospital. We use the Northside Endoscopy Centers, and like I said, we're sort of equally screening and prevention and the medical side, and then the other half is nutrition, lifestyle, and pretty much anything is on the table, in my opinion, that might help lower cancer rates and recurrence rates. I'm always open to that idea. And so we have a team of people to try to help with all those ways we can reduce risk. But you can reach us at thegastroatl.com and give us a call or book appointment, and we're happy to see anybody who might need to see us.
Thank you so much, Dr. Lyday. This was such an interesting topic. We had so many great questions,
Yeah, those were
and
good.
a great amount of people on. We had somebody join us from Maryland, so I think
Mm,
they win the prize from farthest attending
okay.
participant. So we're happy to have everybody on, and we really appreciate everyone's questions. As a reminder, today's program was recorded, so if you want to refer back to anything or share it with a friend, you can find it on our website, cscatlanta.org. We're getting a lot of thanks and love in the chat box, so thank you, Dr. Lyday. And again, if you want to learn more about Cancer Support Community Atlanta, please feel free to check out. We have so many more virtual and in-person free oncology support programs, including a monthly nutrition seminar hosted by an oncology dietitian with Northside Hospital. So please take advantage of the programs that are available to you. Visit our website, cscatlanta.org. All right, well, thank you, Dr. Lyday, again for being
Thank you,
so
everyone.
generous.
Hope that was helpful and enjoy your day. Take care.
Thank you, everyone. See you soon.
All right. Bye bye.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.